All right, guys, welcome back. We're going to be covering chapter 5, the integumentary system. Hey, dad joke for the day. Why are skeletons so calm? Well, because nothing gets under their skin. I know, lame joke. Hopefully that'll put a smile on somebody's face. Anyway, the reason I brought that joke is because we are going to be talking about the integumentary system. And one of the portions of the integumentary system is the skin. All right, let's talk about the structure and function. Okay, we got the epidermis, we got the dermis, and then we have accessory glands. All right, the dermis consists of a subcutaneous layer, which you kind of see, right? Hold on, let me get this cursor working somewhere about right here. Okay, accessory glands. We got sebaceous glands that secrete oil, and then we have the subdural. That word that secretes sweat. Okay, some other accessory organs include the hair and the nails. So as we continue talking about the structure and function of the skin, let's talk about the purpose of it. The main purpose of it, of course, is to protect our bodies from pathogens and other harmful substances. Yes, our body has multiple layers of protection, but the um, layer and level of protection is the skin. It protects us from harmful UV rays. It keeps everything in place. So that's our first layer of protection. Another structure or more function, it does produce secretions from sweat and oil glands, as we discussed in the previous slide. It also provides nerve endings for various sensations, including that of heat, cold, pressure, the sense of touch is also part of the skin. Another awesome function of our skin is that it regulates body temperature. It also synthesizes vitamin D, and it gives the color to the skin from melanocytes, which are produced in the basal layer. There is a reason that we have melanocytes. We'll get to that in some coming slides. All right. What is the integumentary system composed of? Well, it consists of what? We've already discussed this, the skin and its accessory structures. What are some accessory structures of the skin? Well, like we said, we have the hair, we have the nails, and we have the glands. Make sure that you guys understand which glands secrete sweat, which gland secretes oil. Some other functions of the subcutaneous layer, it binds the dermis to underlying structures. It also works in storing some fat. It insulates and cushions the body and regulates temperature. All right, in the basal layer, what specialized cells protect the skin from damaging effects of the sun? So that's what we just talked about. So the melanocytes, which produce melanin, it protects the skin from sun damage. So when you see a person with a lot of freckles, that is melanin being produced as a reaction to some type of exposure. Some of it is going to be hereditary, but some of it is caused because the skin got exposed to the UV of the sun. Anyway, continuing forward, which accessory organs produce oil? That would be the sebaceous glands. And then list the sensations provided by the skin. And we literally just went over this, the nerve endings that sense the heat, the cold, senses the pressure, and it senses the touch. And just like we had done in the previous lecture, we had some combining forms and combining words. So let's go over some of these. So for the skin, we have cutane, derm, or dermat, or dermo. And as we start progressing through, so let's just tackle number one. So if we were to talk about subcutaneous, right? Sub referring to the location of it, right? So sub will be under. So subcutaneous, under the cutaneous, cutaneous meaning skin, subcutaneous, under the skin. So this is how you basically are going to continue progressing through a lot of these words, just breaking things down, okay? Hair, the combining form being pill-o or trick-o, sweat being pseudo or hydro. Blue, a lot of these we have already addressed in the previous slide, but blue, cyanosis, red, erythum, or erythemat, or erythro, fungus, myco, black melano, so melanocytes. Okay, we just addressed that. Fat will be adipose or adipose tissue, so adip being the combining form. Nerve, neuro, so neurologist will be doctor of nerves. Arterial, arteriole, dry or scaly, itchy. I don't know. That one's always gotten me. Uh, Hard cornea. Not sure why 13 is like that, but we're gonna continue going. 14, dry, 0 or ecty. Hardening, sclera, white of the eye, so sclerosis, or sclero being the root word here. Abnormal condition without sweat, so anhydrosis. Treatment with cold, cryotherapy. Resembling skin, dermoid. Okay, pertaining to under the skin, we talked about this, subcutaneous. So sub being under, cutane being the skin, subcutaneous. Abnormal condition of bluing skin, cyanosis. Condition of sweat, pseudosis. And softening of the nail. Oh, that one. I'm not even gonna try. I'm not even gonna attempt that one. Yeah, we'll try it. Anachomalacia. Sure, that sounds about right. White cell, we've talked about this one, was the leukocyte, all right? Black cell would be the melanocyte. Skin that is dry, xeroderma. And transplantation of the same species, homograft or allograft. So a tumor that is composed of cancerous cells will be a carcinoma. Skin with pus, so it's a condition associated with pus, pyoderma. Treatment with cold, we talked about that, cryotherapy. And normal condition of dry or scaly skin, ichthyosis, pertaining to heat, thermal. So some diseases and conditions, so we can address some basal cell carcinoma. It is the most common type of skin cancer, okay? It arises in the basal cell layer of the epidermis, and it's a fresh colored or brown, which will be a later stage. So if we were to look at these pictures right now, this basal cell carcinoma will look like this. Melanoma will look something very similar to this, okay? So when we're talking about basal cell carcinoma, even though it is the most common and it is destructive, it is, however, very slow growing. It very rarely metastasizes. However, it is invasive. It occurs most common in blonde, fair-skinned individuals because they don't have that layer of protection on their skin as a darker individual would. Some signs and symptoms, the tumor mainly seen on sun-exposed area of the body, most importantly in the face, okay? That I guarantee you're gonna see that question again, okay? Where do you see this mostly exposed to? It's gonna be on the face. It can also occur on parts of the body that is rarely exposed to light, but more often than not, it's gonna be those areas that are exposed. Pearly white or waxy bump, often with visible blood vessels, are another sign and symptoms. And the bump may bleed, it may develop a crust or form a depression in the center. These are just some signs and symptoms to look out for when we're looking at basal cell carcinoma. So in regards to treatment of basal cell carcinoma, there are multiple options, but the ultimate goal is to eradicate um, the affected area. Okay, some treatments include cryotherapy, laser therapy, chemotherapy drugs, radiation or chemosurgery is also an option. Surgical excision, where they surgically uh, take the affected tissue out, that is used in over 90% of the cases. So that's pretty interesting thing there. So let's go over some clinically related exercises, all right? This here is Mr. T. He's been advised that a basal cell carcinoma on his face will probably not spread, but will remain localized. It will eventually destroy underlying and adjacent tissue. The spread of cancer from one part of the body to another part of the body is called, all right, well, if you said metastasize, then you were correct. Pretty simple stuff. Some of these clinical related exercises, I'll be able to kind of leave it blank and then produce the answer. Some of them are just going to have the answer as soon as the slide comes through. That being said, on your slide deck, you guys are able to just remove the answers, and kind of play with it so that you guys can get some practice in. Another exercise here, a 70-year-old male is diagnosed with basal cell carcinoma caused by overexposure to the sun. He is advised that the most common site of this skin cancer is, you guys should know this, I literally just addressed this. The most common site is, of course, the face, okay? Make sure that you guys know that. After closely examining a growth on Mrs. A's arm, the dermatologist informs her that it is non-cancerous. The dermatologist charts the non-cancerous growth as which one of these? All right, it will be 9, right there, the very first one. All right, let's continue going under some other diseases and conditions. Abscesses. Oh, this is gnarling. Okay, how many of you have seen Dr. Pimple Popper? I cannot stomach to watch that show, but some of my friends are obsessed with her, but neither here nor there. Abscesses are a localized collection of pus at the infection site. It Sometimes it will be hot to the touch, but not always. Most common signs are the hairy parts of the body, which are exposed to irritation, pressure, friction, or moisture. So, right behind the neck, like this picture is depicting, around the armpit area, around the groin. Those are just some areas where you could see some localized abscesses. There are two types of abscesses. You have the furuncle or boil, which are abscesses in a hair follicle, and then you have your carbuncle, and these are several furuncles developing in adjoining hair follicles with multiple drainage sinuses. So here's an example of that right there on this. Oh, beautiful neck. I don't know who gave that guy a haircut, but yeah. All right, some signs and symptoms, okay? The affected portion of the skin will be possibly tender, painful, swollen. Sometimes it'll be hot to the touch. Abscesses possibly enlarge, soften, and open, discharging that nice pus and necrotic material. Erythema and edema are possible, persisting at the site for days, sometimes even weeks, possibly accompanied by a mild fever as your body is reacting to the abscess. Some treatments, okay, obviously let's go ahead and clean the affected area with soap and water. Applying some type of hot compress or wet compress to the area. It will promote vasodilating and drainage from the lesions, all right? So let's talk about that word right there, vasodilation. We could go ahead and break that down into two separate words, right? Vaso, dilation. You guys do the homework on that one and figure out what that means, okay? Administering topical antibiotics. That's going to be right over the skin. That will help. And then finally, incision and drainage. That could possibly be necessary after the lesion has already been matured, meaning that probably, popping it with with a dual thumb method is probably not going to work. That's where Dr. Pimple Popper shows up and does her magic. Ugh. All right, like I said, here are some clinical exercises. Miss K presents with redness and edema on the neck. The term to describe the reddening of the skin is erythema. Um, Upon diagnosis of a furuncle, the nurse explains that this is an infection caused by bacteria. Obviously, it wouldn't be caused by injury or virus because it's a furuncle. All right, some more clinical exercises. The physician charts a cluster of furuncles in the subcutaneous tissue. It's a carbuncle. All right, that's a cluster of furuncles are a carbuncle. So, any probably easy way to learn this is, you know, it takes a lot of fun to have some cars. That's how I learned it. I don't know if that helps you. Then do whatever works for you guys. All right, Miss S is diagnosed with an abscess on her knee. She asked the physician to explain this condition. How should the physician respond? Well, it would let her know that it's a localized collection of pus at the infection site, characteristically caused by the bacteria known as staph, staphylococcus, aka staph. All right, let's talk about psoriasis. All right, this is a chronic, it is non-infectious inflammation of the skin. It's a disease. It is circumscribed as red patches covered by thick, dry, silvery adherent scales. A lot of people that have psoriasis feel very self-conscious about it. Just know that this is not infectious. It's, you could touch it. It's not going to get on you for touching it. There are many, you've probably seen it on TV. There's many drugs that are out in the market now to treat plaque psoriasis and so on and so forth. But people that have this condition are very self-conscious of it. But again, it's just part of life, nothing to be ashamed of. It's not infectious, so go ahead and treat this patient how they need to be treated. It affects the epidermal cells that produce 6 to 9 times faster than normal. All right. Commonly, a family history is seen when we're dealing with psoriasis. So probably mom or dad had it and now they have it. It may begin at any age. So I know you can imagine how scary it would be if you're a 20-year-old female that has never had this condition, and at a left field, you wake up a morning and you have this redness and plaque thing growing on your hand or on your back or on your chest. It could be very scary, but especially because it could begin at any age. So condition can be severe if onset is in childhood, but if the onset is in adulthood, possibly not that severe. But again, it's open to interpretation. What is considered severe? Some signs and symptoms, okay? Excessive development of the basal layer of the skin, okay? The affected area that typically appears will be dry, cracked, and encrusted. The buildup of skin composed of living and dead tissue. So when we're dealing with psoriasis, one of the most common sites are going to be, of course, the scalp, the knees, the elbows, the umbilical, and the genital area. The so you can imagine how self-conscious you would be as a, if you were to be intimate with somebody and you have psoriasis in your genital area. So this is something that it's not as rare as you would think. So it's just something to keep in mind. And why people with psoriasis are so self-conscious about that is because of the locations where they the condition is manifested. All right, some treatments. Well, it just depends on the type. It depends on the extent of the disease, and it depends on the patient itself. Like I said, there have been multiple medications out in the market that have been geared towards patients that suffer from psoriasis. Some topical medications. There have been some oral medications, some vitamin D. Some and wet dressings definitely help. Keep in mind that the skin is getting dry, so the more you can maintain that the affected area moist, the better it'll be, especially with the itchiness that is associated with it. Some other treatments include some UV light therapy to kind of slow down cell production. So the exposure amount depends on the condition. It also depends on the pigmentation of the patient's skin and the susceptibility of the patient's skin to burning. Okay, UV light from an artificial force is definitely the preferred method. Not going outside and sitting under the sun and thinking that's going to take care of everything. Probably not the smartest move, but yeah. All right, so let's go over some clinical exercises. All right, so Mr. W presents for treatment of psoriasis with UV light therapy. The doctor explains that the therapy retards cell production and slows horny growth on the skin. Overgrowth of the horny layer of the epidermis is a condition called. All right, let's address this. Horny growths. All right, cutaneous horns refers to a skin growth that appears as a cone shape or horn-like projection caused by overgrowth of the most superficial layer of the skin, the epidermis. Okay, so now that we have that definition out of the way, we'll continue going. All right, so overgrowth of the horny layer of the epidermis is also called, all right, hyperkeratosis. Okay, hyper is faster than keratin, all right, and ptosis being the condition, all right. Now, those of you with weak stomachs, all right, I'm going to show you what this condition looks like. If you do not like crusty feet, just look away for the next 10 seconds. But this is what hyperkeratosis looks like. You could kind of see all the growth. Let me try to get this pinpoint here. You can see all this growth that kind of looks kind of like cone shaped. Specifically, you can see really good right here above that pinky or a small toe. Anyway, enough with that slide. Let's continue. All right, some more clinically related exercises. Let's talk about Miss M. She was diagnosed with psoriasis. The physician comes into the room and explains that the most common sites of psoriasis are, all right, so we talked about this. We were talking about the scalp, elbows, the genitalia area, okay, the knees, the umbilicus, all right, it is what it is. That's where it's most common. All right, for chronic psoriasis, a powerful form of UV light therapy directed to plaques is effective in controlling scaling and inflammation. This type of laser is called, now we have not talked about this laser, but the laser is called the excimer laser. And here in the next slide, I have a picture of what that laser looks like. Here we have this patient receiving treatment using that laser therapy. All right, continuing forward with some more conditions and diseases, we have acne vulgaris. All right, this is a very common inflammatory skin disease, and it affects the subcutaneous glands and their hair follicles. This is acne. So obviously the most common area is going to be on the skin of the face. All right. It's going to be characterized by the appearance of comedones, aka blackheads or whiteheads. It will also be characterized by the appearance of papules and of pustules. All right, those being the small raised areas of the skin, and those are filled with pus. You want to kind of pop them out or whatnot. That's what those are. Okay. Like we just discussed, it's usually found in the face, the chest, the upper back, and the shoulders. It is most commonly caused by, of course, that hormone changes during puberty, but can appear at any age. Some kids are born with it, and then some adults generate it at 40. I sure hope that at this age I do not develop this because yeah, I just wouldn't want that, right? The underlying cause of this, it is genetic. So mom, dad, grandpa, grandma had it. Um, Another possible contributing factors include stress, external irritants, such as soaps and cosmetics. I know that I might date myself here, but there's this episode on Seinfeld where Seinfeld keeps on getting this outbreak of acne, and he can't figure out what's going on. And here comes Kramer, shows up, and he's been cleaning his meat cutter machine with Seinfeld's face towel. So this is a perfect example of an external irritant that caused this acne vulgaris. This is a very, very funny episode. If you guys are into just not having to think comedy, this is a great show. Some signs and symptoms include some acne plug that commonly appears first as an open comedo or blackhead. Okay, color in the comedo is caused by the melanin produced in the hair follicle, not by dirt. So when you start seeing all those blackheads and you want to think, oh man, I must have had a dirty face to cause this. No, it's not because of that. It's just the melanin produced by the hair follicle in there. Eventually, enlargement and rupture or leak of the plug will happen, and the contents will spread to the dermis. Results in inflammation and acne, pustules, and papules. Development of scars if chronic irritation continues over a period of time. All right. It's just Here's an example of what that acne scarring looks like. Again, doesn't always happen. This is a chronic condition. This happens when somebody's had acne for multiple years, and just the skin can only take so much. Okay. All right, the treatments for acne vulgaris depend on a plethora of information. Overall, the goal to the treatment is to reduce the bacterial count, decreasing the the sebaceous gland activity, and preventing inflammation of the hair follicle. Okay, antibacterial solutions can be applied to the skin either orally. Antibiotics could be administered. It could be orally or even a combination of both. Topical agents may be used alone, again, or in combination with something else. The main goal to the treatment is really to keep the skin as clean and as dry as possible. So let's go over another exercise here. So Johnny's an adolescent and he suffers from chronic inflammation of the skin disorder on his face and his chest. He has been squeezing the blackheads and whiteheads, and those areas on his face are now inflamed. The medical term for blackheads and whiteheads is, all right, comedones. Elisa has been diagnosed with an inflammatory skin disease known as acne vulgaris. To decrease sebaceous gland activity and to prevent follicle from becoming inflamed, the physician prescribes an antibiotic, antibromic, or antifungal solution to apply to the skin. Which one of these do you think would be correct? All right, guys, so it should have been antibacterial. You should have known that one. Um, why would it not be antifungal, right? We got to really think about this. Is the acne vulgaris fungus or bacteria? All right, so if we're fighting a bacteria, it will be antibacterial. If we were fighting a fungus, it will be antifungal. But acne vulgaris is a bacteria, so that's why antibacterial will be the correct. All right, another condition and disease we can discuss is scabies. All right, scabies is a contagious skin disease that is a direct result of infestation by the itch mite. It is transmitted by direct skin-to-skin contact, and it's transmitted by prolonged contact with infected clothing, bedding, small animals. So Fido or your little cat can bring it in. Funny side note and story, some history fact here. Back in the 1900s, the very first automobile recall was due to Henry Ford's vehicle. They were getting Spanish moss and they were stuffing the seats in this vehicle as cushioning for the seats. Again, this is back in the 1900s. And the Spanish moss that they were putting in there had these little itch mites called chiggers. And so you would be driving and you were getting bit by chiggers. And that's why the first recall in automobile history was caused by this little mites, and scabies came from some of those bites. All right, some signs and symptoms. All right, patient could be asymptomatic while the parasite multiplies, meaning he's not going to show any symptoms. The parasite will begin burrowing into the superficial layer of the skin, appearing as a short, wavy, brownish black lines. All right, here you can see that parasite kind of going right up in here and burrowing there, and then it kind of has this little mound on top, kind of like if you have any moles infestation in your front yards. I'm dealing with that right now, but that's kind of what it'll look like, but in your skin. All right, it could be itchy, it could be rashy. That's going to be the major complaints of this. All right, the lesions typically appear thread-like. All right, they appear most common between the fingers, in the axilla, in the wrists, the elbows, the buttocks, the genitals, and the nipple area. So treatments, all right, so a cream or a lotion, topical scabicide, usually applied in a thin layer to the entire body from neck to feet, including the genitals, the umbilical, and most importantly, where the skin fold areas, so right here or behind the knee. Yeah. So let's go to this exercise, all right? 16-year-old girl visited her grandparents at their farm last month and petted many of their animals, probably this nice little piglet. Now she complains of itching and rash that appears between her fingers and on her wrist folds, okay? The physician examines her rash and prescribes a topical disinfectant cream to destroy the parasite known as the itch mite. He charts her skin disease as, come on guys, this is so easy. Scabies, you should have, anyway. Let's talk about impetigo. It's a common contagious superficial skin infection. It's marked by a fluid-filled blister that becomes pustular, ruptures, and forms a yellow crust. Vesicle, small filled blister. It could be a bulla, large fluid-filled blister. Okay. Impetigo, some signs and symptoms. Some lesions can be benign. Those lesions can rupture, and then it'll leave this honey-colored serous fluid that comes out of it. The hardening of that fluid and eventually formation of a thick yellow crust over the affected site. Possibly occurring anywhere, but most commonly it's going to be around the mouth area, the nose area, the neck, and extremities, so your hands and your feet. Possible erythema with ulcers and some scarring are also symptoms and signs. Treatments, of course, you could get some topical antibiotics, some oral antibiotics, or even a combination of both. Make sure that you're thoroughly cleaning the area, cleaning the lesions. Those are basically the best way to treat this. A good hygiene to prevent that skin to skin or person to person contact, so that to limit the spread of the condition is definitely a good treatment. Another exercise here. So Carl is diagnosed with a bacterial inflammation skin disease characterized by vesicles and pustules and crusted lesions that form yellow crust. The physician advises him to cleanse the lesion 3 times a day and prescribes a topical antibiotic to treat this contagious skin infection, which is known as, come on, impetigo. All right, alopecia. Some vocabulary challenge exercise. Alopecia is the absence of hair loss. Make sure you know what alopecia is. It's not baldness, it's alopecia. It's the absence of or hair loss, especially in the head, known as baldness, right? Alopecia. Debridement, removal of necrotizing tissue from a traumatic or infected area by surgical excision. All right. It is used to promote healing and to prevent infection. Diaphoresis is a medical condition in which a person sweats excessively and unpredictably, even when the temperature is cold and when the individual is at rest. Hirsutism, excessive growth of hair in unusual places, especially in women, may be due to hypersecretion of testosterone. Remember, women are supposed to have more of estrogen, and men are supposed to have more testosterone. So a woman with a higher sense of testosterone will have abnormal hair growth where it shouldn't be growing. So a woman shouldn't have this nice goatee like I have, but if she has a high testosterone, then she probably will. All right, class, continuing with some procedures. This here is called a debridement procedure. It is basically when a provider uses a sponge or some type of material to scrape and remove any foreign material, any dead or damaged tissue from a wound. It is not pleasant to look at. It is somewhat painful, but it is necessary. I've seen a lot of these procedures done with patients that would fall off of a motorcycle in a motorcycle accident, and they get that asphalt material inside of the wound, and so you got to scrub that wound to get that foreign material out. So that's a very common procedure. Another procedure is called the Mohs surgery. In this procedure, a thin layer of skin cancer is removed, particularly tumors with irregular shapes and depths. Then a microscopic examination of each layer of excised tissue is performed. Repetition of procedure is continued until no trace of cancerous cells remain. All right. They do have this thing called flap repair. So this patient here has undergone that repair. This is post-Mohs surgery. In the far left, you could kind of see how the patient has a very visible wound, and then a flap is inserted there, or not inserted, yeah, inserted, and sutured. And then the goal is to kind of limit that scarring of that Mohs surgery. All right, skin grafts. All right, you have different types. You have allograft, autograft, synthetic, and xenograft. Okay, each one is defined differently. Here's the terminology for them. Just know that autograft is a tissue transferred from one position to a new position in the same individual. So auto being the same, okay? An allograft, okay, is tissue graft between individuals of the same species, but with no identical genes. All right, so from Billy to Tommy, okay. A xenograft is a tissue graft between members of different species. They were formerly called heterografts. And then you have the alloplasts, which aren't even in our book, so disregard that one. All right, so to prevent infection, the physician removes foreign and necrosed material from his case wound. The therapeutic procedure is charted as which one of the following? I sure hope you did not put cryotherapy because we've already discussed what that was, okay? It will be debridement. Miss J is diagnosed with, well, you already know what that one is. On her left hand, the dermatologist freezes and destroys the lesion with nitrogen. This procedure is called cryosurgery. Why is it cryosurgery? Because cryo is cold. Okay. The surgeon informs Miss T that a layer by layer of her skin tumor will be excised until it is removed. What is this type of surgery? That's a Mohs surgery. Miss X is informed that pus will be removed from her abscesses by incising and draining it. The procedure is abbreviated as IND. All right, Miss X is a burn patient and she is given a transplant of healthy tissue from her son. What is this type of transplant known as? So that will be your homograft or allograft. Remember, same species. All right, Mr. G, a fireman who suffers a chemical burn, is having health issues transplanted from is having healthy tissue transplanted from a pig. What type of transplant is this called? Okay, now this is a different species, so this will be a xenograft or heterograft. All right, let's talk about the scratch or the prick test. All right, this is a way to identify a person that may have any type of allergies. So the way this thing works is, let's say I've been having some allergic reactions and I don't know for what. This plate here will have different low amounts of different areas. So like, let's say this circle will have tree pollen, this one will have grass pollen, this one will have birch, this one will have olive tree, this one will have zoysia grass, this one, you get the point. And then this thing that this provider is holding here, they'll dip it on this, and then there are different places, different procedures, call it different places. When I had mine, it was done in the forearm area. So they will take that, they'll dip it in the fluid and then they'll pass it through and it'll just make a small indentation in the skin. And then after a certain amount of time, they'll go by and they'll see if you have a reaction to one of these. Now, of course, one of them is going to be a control, meaning that it does not matter whether you're allergic or not, you're going to have an allergic reaction to the control. And then the rest will be the different items that they're trying to figure out whether you're allergic to. So at a very minimum, you will have one reaction, which will be the control. This is pretty much exactly what I just told you. And as you can see, this is exactly where how it will look. You know, you will have a reaction and it'll kind of bubble up just like you see in this picture. Another procedure is a biopsy. This is when tissue sample is removed from the body and it's examined microscopically. It is usually done to establish some type of diagnosis or to identify a type of cell. A lot of times this is done to identify whether a cell is cancerous or not, and it'll give the provider a way forward as to what they're going to do. So some instruments here. So instruments to cut skin, you got the dermatome or dermatotome. It's a pretty interesting instrument. It kind of looks like what you would use to shave off potato skins off your potato, but it basically cuts a layer of the skin so that you can lift that layer of the skin up. Okay. Pertaining to within the skin is called the intradermal, And the study of the skin is called dermatology. Okay, when it comes to pharmacology, you got your antibiotics. Make sure you know what those are. The difference between antibiotics, antifungals, antipyretics, and corticosteroids. Make sure you're able to understand the difference between each one of them. Okay, we got some clinical related exercises here that are also, like I said, they're in your slide deck. You guys can go through that. Here's some more exercises. It's very important that you guys know when to use antifungal versus when to use antibacterial, because I can guarantee you're going to see it again. All right, class. Well, that's all I got for this chapter's lecture. As usual, if you have any questions, make sure you reach out to me. I can't harp this enough. You have to make sure that you guys are reading your material that is in your textbooks, as well as the extra material that is given to you guys through the website. Your chapter 4 and chapter 5 exams will be due by midnight Sunday. So try not to wait to the very last minute to accomplish those exams or to do all your work, because the work that you're going to be going throughout the week is going to help you ace that exam, okay? And while we're in the topic of the exam, just keep in mind that I'm giving you 1 minute per question. So if you have 40 minutes, I'm giving you, if you have 40 questions, I'm giving you 40 minutes. It is a closed book exam. Now, I know most of you are going to try to go through the book, go through your notes to answer these questions. You do not have enough time to look up every answer. Okay, you're not even supposed to. It's a closed book exam. So just try to learn the material. If you have any questions at all, I can be reached via email, or you can message me through the Remind app, and I'll get back to you guys as soon as possible. Okay. Now you guys have a blessed day, and I'll see y'all next week.